527. That is the number of deaths caused by accidental drug overdose just this year in Delaware alone. And with limited access to additional treatment and healthcare services, a complex set of challenges faces our community.
So then the question is, what can be done to fix the pressing issue? Well, it starts with education on the problem and the proven solutions. So with us this afternoon, this is Peggy Geisler. She's the Executive Director of Sussex County Health. Thank you so much for joining us this afternoon.
Thanks for having me.
Good to have you. Good to see you. So define for us, what is substance use disorder?
Substance use disorder is when an individual usually has a predisposition genetically. Oftentimes people think it's a personality issue. They pick up drugs or alcohol, their body consumes it differently, they metabolize it differently, they become addicted, they continue to use it, and then it can actually go into chronic addiction, right?
Okay.
And because of that, they oftentimes make poor choices, they oftentimes look for ways to seek those drugs. It becomes the primary focus of their lives instead of the other things that are pretty much healthy. Their patterns of behavior go from doing enjoyable things to drug-seeking behavior and then often spiral.
Yeah, and we throw around the word holistic a lot these days. There's actually a holistic approach to this disorder?
Well, I think so. I mean, when you think about it, most of the times it's a chronic health condition. So counseling oftentimes, because it's emotional, it has a lot of collateral damage. You need physiological help for a doctor or treatment. Oftentimes, specifically, you know, some people have to use harm reduction methods like Subutex and other types of drugs that help them wean off of their opioid addiction. And then at the same time, eating right, emotional well-being, spiritual well-being oftentimes, community connectedness. Many times these individuals isolate or just stay around individuals who are also engaging in that behavior.
Right. Okay, so there's treatment. What about prevention? What can we do for prevention?
So, you know, I think this is a really good question. You know, while we're looking at the opioid epidemic, what we're not looking at is the rampant alcoholism and other issues that are going on in our communities, right? And so one of the things to think about here is, how do we start young? We need our kids to be educated. People need to be informed, right? You know, how do we give people things to do, other choices besides just out drinking, partying, or hanging out? You know, families need opportunities, access to healthy opportunities and the things to do out in the community, right?
Yeah.
There's not a lot for kids to do, teenagers especially.
Yeah. Okay, so you have a campaign, Narcan Can Save a Life, or Narcan Save a Life campaign. Can you tell us the goal of that?
Sure. Under the Delaware Goes Purple initiative, which is statewide, and you're going to be hearing, you know, we do that every October. I'll be back to see you for that. But the Yes I Can Save a Life campaign is really about everyone. You know, remember the old days when nobody knew how to do CPR and then everybody?
Right.
Well, Narcan's no different. You know, 2,400 people last year were saved through Narcan. Of the ones who were not, it's because there was none on premise.
How about that?
And they were in families' homes.
Oh, wow.
So most people are dying in people's homes or in places such as a convenience store or maybe in, who knows, one of the other chains. You know, be careful who you say, right?
Right, yeah.
But let's say you're somewhere, if you have Narcan, you carry Narcan, it's easy to administer, it's quick to learn, you can save a life. Why can't you be a local hero? You know, if you know how to do CPR, you should also be carrying Narcan. You should know these things. We should be here for the good of the community. People go, well, you know, that's their choice. Is it really? Chronic health condition, it's a chronic health disease. It is an addiction, and we want to give them the opportunity to be here tomorrow to recover.
Sure.
Takes you a few seconds, doesn't cost you anything. There's ways to find out about it. Get your staff trained if you haven't been trained. Get your family trained. Make sure you're there, ready, willing, and able to help a fellow citizen.
When we mention harm reduction strategies, what are we talking about?
We're talking about setting up the environmental structures in our community that allows us to err on the side of prevention, education, and early intervention.
Okay.
So this is when we say harm reduction, if I'm there and you're overdosing and I have the strategy to support you so that you don't die in the moment, that's a harm reduction strategy.
Gotcha, okay.
Yeah.
A lot to think about.
It is, but you know what? Here's the problem. Everybody else thinks it's everybody else's issue.
Exactly.
There's collateral damage when somebody dies from an opioid overdose, right?
Yes, there is.
And we think that it's only people on heroin, but there are people out there enjoying marijuana and these other things that could be laced with fentanyl.
Yeah.
They could have been doing something they didn't anticipate would take their life. Wouldn't it be nice to know that there's a good citizen standing around that's ready, willing, and able to assist?
Step in. There you go.
Peggy, thank you for coming
Thank you.
in.
Thanks for having me.
Good talking to you.
And we'll see you.